behind, but side by side in true equality. So sing a song for women everywhere. Let it ring around the world and never, never cease. So sing a song for women everywhere. Equality, development, and peace.
A child's well-being is influenced by a variety of protective and risk factors. The environment a child is exposed to can be one of these factors. Fostering psychological and emotional fitness is an important part of mental health. Children's mental health is often defined as different from adults' mental health and more multifaceted because of the unique developmental milestones that children experience. Recently, we discussed bullying in institutions, and we learned that bullies are not only adults, but also children who act aggressively towards others with an intention to make them uncomfortable. With our guest today, we shall be discussing in details children's mental health and how it influences their emotional, behavioral, social, and cognitive domains. We'll be going on a short break, and when we come back, we'll continue this discussion in details with our guests. Remember, you're supposed to like and share this so that others can also learn and get enlightened. Thank you.
Good morning and welcome back to the show. Our guest for today is a graduate of medicine and surgery from the Ahmadu Bello University, Zaria, Kaduna State. She's also a member of the West African College of Physicians and a fellow of the National Postgraduate Medical College of Nigeria. She currently works at the Plateau State Specialist Hospital and the Rayfield Medical Specialist Hospital in Jos, Plateau State as a consultant psychiatrist. Please welcome with us this morning Dr. Kokat Poyi Megida. Good morning, ma, and you're welcome to the show.
Good morning, man. Welcome to the program. So we go straight into what we have for you today. What is mental health?
So mental health, the WHO definition, that's the World Health Organization definition of mental health, is a state of well-being where an individual is able to realize his or her own abilities. They can cope with the normal stresses of life, and they can work productively and fruitfully and contribute meaningfully to their communities. That's the WHO definition of mental health. But the definition of mental health for children is a little bit different because today's focus is on children, right? So yes, that for children, it's a little bit different, and it's seen as a state of well-being and the optimal development of children based on their emotional, behavioral, social, and cognitive domains. That's their ability to develop, to reach appropriate developmental milestones and emotional milestones, and then for them to be able to learn appropriate social skills and to be able to cope with problems. So if we see for children, it's a little bit different, but some certain things still stand out in both the definitions of mental health generally and then for children.
Okay, thank you, ma'am, for that clear definition of what mental health is. So can you also want to find out from me what are the mental health problems that can occur in children?
Now, for children, the mental health issues that occur in them is not too different from that which occurs in adults, but there are peculiarities as with how the mental disorders manifest. When we talk about mental health issues now, you know, when we're talking about mental health, we always let people know that it's a spectrum, you know. So it's not that at the end of the rope on bad mental health are mental disorders. You understand? It's like a spectrum, you know. We move between good mental health and poor mental health. And then in extreme cases of poor mental health are when we start having mental disorders. Okay. And when we start talking about mental disorders are when there's persistent levels of distress that gets to affect the ability of the child to be able to function either in school, at home, or in the community. That's when it becomes a disorder. So for children, there's a myriad, as in there's a whole range of mental disorders that can occur in them, right from mental health disorders that are as a result of their development. There are some developmental mental health disorders like them ADHD, that's attention deficit, attention hyperactive deficit disorders, and then autism spectrum disorders, you know, to learning disabilities. Then we have depression that also occurs in adults, bipolar, substance use disorders. So it's some of them are similar to what occurs in adults, you know, except for some of all those neurodevelopmental disorders I told you, like the autism spectrum disorders and some others that, you know, actually starts from childhood before it continues into adulthood.
So specific to children, what are the key factors that can affect their mental health?
Okay. I think it's worthy of note, you know, for us to know that mental health disorders in children are actually quite common. It is said that about 1 in 6 children experience mental health disorders. Some people quote 10% of children are adolescents. Some say about 1/4. So it's actually something that is quite prevalent among children. And the sad thing is that very few of them actually get to have, you know, the attention that they need. And so it appears to be quite overlooked. But what are some of the things, we call them risk factors, that makes children vulnerable to coming down with mental health disorders? We usually group them into biological factors, psychological factors, and then social factors, which also include environmental factors. For children, and I think generally, you know, in coming down with mental health disorders, the biological factors can come from hereditary factors. If you have a parent or there's a family history of a person with mental health disorders, it increases the chances of a child coming down with it, what we call genetic factors. Then you can have developmental issues. That's while the child is still in the uterus, is still a fetus. The child can get infections, which can affect, you know, the growing brain. The mother might have had some issues, maybe hypertension, diabetes, different issues anyway, that can affect the development of the young brain while still in the uterus. At the point of delivery, you can have issues, at times prolonged labor, anything that gets to affect, you know, the young brain at the time of delivery can increase the chances of a child coming down with mental disorders, you know, in childhood and then in adulthood. Childhood, infants, infections, things like jaundice, you know, infections generally at that young, at that infants, in the infant period, can affect the development of the brain and then increases the chances of a child coming down with mental disorders. Then as they grow up, when we look at psychological factors, issues of esteem, when a child has low self-esteem, when they have poor, images of how their bodies are, when you have children that get to be highly self-critical, children that find it difficult to be able to cope with issues that are happening around. And then when we have social issues, like particularly in our own environment now, the insecurity that is happening, that lack of safety, sense of safety, it increases the chances of children coming down with mental disorders, parental conflicts, children growing up in families that there's a lot of disharmony, there's a lot of violence within the home, parenting style of parents, either parents being too authoritative and not allowing children to be able to communicate properly. Then the issue of peer pressure, the issue of poverty, the issue of traumatic events, all these, they generally sum up to increase the chances of a child coming down with mental disorders. And one thing we should note is that there's no one singular cause, but it's usually an interplay of different factors that come to work together to increase the chances of an individual coming down with mental health disorders.
Yeah, thank you very much. Because I know when you started talking initially, I was going to ask you what of the other factors, apart from the ones that are not medically diagnosed. We'll be going on a short break. But before we go, Ijoma, I know you have another question to ask her. Do you have something to ask her?
Yes, I do, ma. I know you and your team, you carried out a psychosocial assessment for one of P1's projects in Adamawa State titled Engaging Children to Counter Violent Extremism. We would like to find out from you the findings from the assessment, and would you say it actually outcome showed it had some effect on the children's mental health?
Okay. In the assessment that we did there, it was we conducted it in two villages that had been affected by violent extremism, which had happened, I think, around 2017, 2018. Prior to the onset of the schooling program, the schooling initiative that you guys started there. So the assessment, we actually looked at, there was a strengths and difficulty questionnaire that we used, which is used in children to actually see how they're able to cope, especially in issues of trauma and violence. And what we found, about 12% of those children, the children that were assessed, actually had some form of either borderline or abnormal difficulties, and that were experienced most likely, as a result of, the violent extremism that they had encountered. And about 26% of them met the criteria for post-traumatic stress disorder. So, it's actually in line with, what it is that we're talking about, that sense of safety, the issue of trauma, the issue of poverty. These are all things that, makes children more vulnerable in coming down with mental health disorders. However, one of the things that we actually noticed during that study, because among the questionnaires, looking at the strengths and difficulties, there was an aspect that looked at pro-social skills of the children, and quite a number of them actually scored quite high. And part of what we attributed it to, yes, the violence had happened some years ago, but the presence of, that school initiative, it actually helped these children, as a form of distraction, in thinking about, what had been happening to them. And it created an avenue for them to also be able to express themselves. So it was part of the factors that actually helped in strengthening these children. And quite a number of them, actually scored high, on the pro-social scale that we assessed, during that assessment. So, it just gets to tell you with what it is that we're talking about, things that makes children more vulnerable to coming down with with mental disorders. And then I'm sure as we get talking, we'll see part of the protective factors that helps to build up their ability, to that helps to protect them from coming down with mental disorders.
Thank you so much, Ma, for this input. We'll be going on a short break. And then when we come back, we'll continue this discussion. For our viewers, ensure you like this program and you also share this program so that other people on your platform can also watch and learn from it. Please stay tuned.
Welcome back to the show. I hope you're enjoying this conversation like where we are here. Before we went on the break, Ma, you explained to us the findings from the assessment and how the children's mental health has been affected. And there were some recommendations you also gave on how parents can help these children overcome some of these issues. But going to the next question, we'd like to find out from you, considering the environment we are, the Nigerian environment, are young people more likely to experience mental health problems?
Yes, they are. I think it's linked to what we just spoke about earlier on. Looking at the Nigerian environment, it's what exactly is happening now. There's increased rate of poverty, there's increased rate of children out of school, there's increased rate of insecurity, there's increased rate of uncertainty. The uncertainties are enormous. So when we stay and look at all those things, parents are struggling to make ends meet. Children cannot go to school. Those that can afford to go to schools, like if we look at those that are, in the university setting, for those that are below 18, they're still children. They are out of school now because of the strikes, the incessant strikes. So when you look at all these things all put together, the environmental stress is a lot. The social stress is a lot, And with the increased rate of poverty, people are finding other means of making money. And, now you see the increased rate of all these Yahoo boys and everything that is happening. It also comes from the peer pressure. They're struggling to make ends meet. They want to be able to have something, for themselves. So when you get mixed up in all these things, it gets to increase, the chances of people coming down with mental health disorders, a different range of mental health disorders, the whole spectrum.
Thank you, Ma, for that explanation.
Yeah.
So we also want to find out from you, what issues do you think contribute to this within our context? And how does it affect their growth, development, and social life?
Within our context, I'm sure we're already seeing what is happening around the level of poverty. Poverty plays a very significant role in people coming down with mental health disorders. How does it do that? As we're looking at the risk factors, what makes people vulnerable in coming down with mental health disorders? Some of the things that we looked at were some of those biological factors. So when you have a mother who is pregnant and cannot take care of herself very well, she doesn't have the ability to attend antenatal care and take what she needs to take, for proper development of the growing fetus. She's exposed to different kinds of infections and cannot get proper treatment for them. Already, before that child is even born, you have started increasing the risk of that child coming down with mental disorders. It goes to the point of delivery, she can't afford a hospital, she births the child at home, different complications that start, that ensue at the point of delivery, after delivery, the child cannot get immunized. If you just think just on the line of poverty, the child is not eating well, the child cannot develop properly. All those things get to affect the growing brain and increases their vulnerability in coming down with mental health disorders. Then we move to, the issue of schooling. The child cannot go to a proper school. The issue of esteem starts dropping. They can't even go to school, so they become more exposed to a lot of vices. The issue of peer pressure starts building up. Them being able to cope or being able to experiment or to try to find other ways of handling those things, they go into the issues of substance use, and the rest, which increases, which in itself, can cause mental disorders or increases their risk of coming down with mental disorders. And then we go to the issue of insecurity. It's a major thing that we're dealing with now in the country. When children feel threatened, when they don't feel safe, that becomes another issue. It becomes a source of anxiety, a source of depression. And at times when they're trying to cope with that, they resort to using substances or other things to be able to deal with that. The issue of parental conflicts. Now, what has been trending recently is, the issue of domestic violence. And quite often, children are the ones who get caught up. They say when the elephants fight, the grass suffers underneath. They witness this violence that is happening within the homes, and it tends to worsen that sense of safety and sense of security, which initially comes from the family. So there's a threat, there's lack of safety, a sense of knowing who you are. So, when we just look at some of those things and you spiral it down, that naturally it gets to affect their esteem. It affects their image, their sense of image, and their ability to be able to cope. So naturally, what else do you get? They will actually come down. They have increased vulnerability in coming down with mental health disorders. These are just little things that we're even talking about in our environment. If we go deeper into what is happening in our country, then you would know that our children who have not come down with mental health disorders actually have some level of resilience, because there are so many things that are lambasting them, left, right, and center, that gives them every reason to actually have mental health disorders.
Okay, thank you very much, ma'am, for that. I want to ask, how can parents look out for their children's mental health, especially this holiday season that people are back home, schools are vacated? How can parents monitor the mental health of their children to ensure that they are good and they are balanced?
Okay, like I said earlier, quite a number of children are, having different forms of mental health challenges that, are usually overlooked. So it will be good for us to just have a little idea of some of the symptoms that, can raise one's awareness as to, okay, what exactly is beginning to happen to my child. When you start having, consistent post-school performance in a child is beginning to complain a lot of physical symptoms, headaches, repeated headaches, stomach aches, they're having issues with sleep, appetite. They start displaying what we call regressive behaviors. That's behaviors that a child has already, gone above that age. He starts doing it again. Maybe like you start having a child who had stopped bedwetting, then suddenly they start bedwetting, or they start becoming very, very clingy, to their parents. They start becoming unusually aggressive, rebellious. It's not enough for us to just say, oh no, this child has started becoming stubborn. it's for us now as parents to start looking at. We should be able to develop good relationship with our children. We should be able to communicate properly with our children and be able to listen to them attentively and actively. When we talk about active listening, it's not just hearing. You're listening to your child with your ears, you're listening to your child with your eyes, you're listening to your child with your heart. So you're hearing what that child is saying beyond the words that they are speaking. You allow them to be able to speak freely to you. And when they feel comfortable to be able to speak freely to you, there are quite a number of things that these children will be able to tell you that they're experiencing, that opens your eyes to what exactly that they're dealing with. In the home front, children need to feel loved. They need to have a sense of security. That's the first place that you can make them feel secure, regardless of what is happening outside. When they have that sense of security and that feeling of being loved within the family environment, it improves their self-esteem. It improves the images they have of themselves, and then it builds up their resilience and their ability to be able to cope when they are faced with issues outside. Because when you give them that nurturing environment within the home, you're able to help them regulate their emotions, able to teach them how to deal with emotions. When we're looking at children, it's different age groups. We have those that are preschoolers, those that are in school, those that enter puberty, that's another age group on its own, when they're experiencing hormonal changes and the rest, that affects their emotions. So as parents, when you have that nurturing environment within the family, you're able to teach your children some of these things that they're experiencing and how to be able to navigate those periods when they come. When they have increased self-esteem and a proper image of who they are, of what their values are, it helps them to be able to deal with peer pressures when they come, because they already have established values. They already have established esteem of who they are. It helps them to be able to cope, with peer pressures and when they are out. So the family plays a very, very significant role, very, very significant role in the bringing up of these children, because those initial periods before they even step out, they spend a significant time within the family, and how they're able to navigate that period determines how they're able to deal with other pressures and other issues that they face outside. Then the other things are, for you to help them maintain good physical health, for them to, to be able to eat well and be healthy as much as you can. Regular exercising. We encourage children to play. That play is very good for children, because it is one way of helping them. When children play, they're able to express certain things that they might not be able to say in words, especially for the younger kids. When you listen to their plays, you watch their plays, certain things might come out that they might not be able to come out and tell you, but they act it out in their plays, and then you encourage them to also volunteer, so that they also think about, what they can offer to other people, so that it is not only about themselves. Giving service to other people without expecting anything back. When you do this, you actually, it's some of the few things that we can do to help to build, to improve the mental health of children, and then it reduces their chances of coming down with mental health disorders in future.
Thank you very much, ma'am, for explaining this in details, mental health for children and how it can be monitored. I like the fact that you explained the ones that are medically diagnosed in the hospitals, the one we have little or no input or impact on. And I also like the fact that you spoke about the ones that are affected by the environment that children
Mhm.
are exposed to,
Mhm.
and how we can watch out for this. Thank you very much for this, your explanations and what you have done on this topic. Before you go, Ijeoma, would you have something to add?
Yes, I like the fact that she talked about the role of parents in ensuring they care for their children. So now, majorly, parents will think about the child's physical health, but the mental health is very important. So I like the fact that she pointed out ways parents can, understand the children's mental health and the signs, maybe signs of how you know what if your child is going through mental health or stress.
Issues,
Yes, so it's really clear. So as parents, we have a role to play to ensure that our children positively, mentally are fine.
Thank you, Jama, for that. And thank you so much, Dr. Krokat Megida. Thank you, our viewers, for taking out time to join us today for this session. Remember to like and always share on your platform so that others can learn and get enlightened. We will see you next week again on Friday when we discuss another interesting episode still on women empowerment. For now, I would say have a wonderful holiday. Thank you.